Let's continue with the short head of the biceps. The short head of the biceps has been described as having 6 attachments. The 3 main attachments are the direct arm, the anterior arm, and the capsular arm. The direct arm inserts directly onto the fibular head, just posterior and proximal to the direct arm and the long head of the biceps. The anterior arm courses deep to the fibular head and inserts on the proximal lateral aspect of the tibia, just posterior to Gerdy's tubercle. The capsular arm is better seen here in the posterior view and inserts on the posterior lateral capsule as well as the fibula. There are 3 other commonly described attachments. The proximal muscular attachment connects the short head to the long head of the biceps. The capsuloosseous layer gets contributions from the iliotibial band and forms an extra-articular sling around the knee. And finally, the lateral aporonic expansion inserts on the deep or medial aspect of the fibular collateral ligament. Let's now go to the video dissection. Notice the muscle belly of the short head of the biceps, which extends almost entirely down to the knee joint. The first and main attachment of the short head is the direct arm. The direct arm, like the direct arm of the long head, inserts directly onto the fibular head. Deep to the direct arm is the anterior arm. It courses deep to the fibular head and inserts on the proximal and lateral aspect of the tibia. It also inserts here with the mid 1/3 lateral capsular ligament. This insertion can be involved in an acute ACL injury, producing the so-called Sagan fracture. The third main component is the capsular arm, shown deep here by the pointer. The capsular arm inserts on the posterior lateral aspect of the capsule, as well as the fibula. There's also a proximal muscular attachment connecting the short head to the long head, and the capsuloosseous layer. Again, the capsuloosseous layer gets contributions from the iliotibial band and inserts on the proximal lateral aspect of the tibia. Its clinical significance is that this is what is reconstructed in an extra-articular ACL reconstruction, which can be done especially in a revision ACL setting. Finally, the lateral aporonic expansion, again, is a thin, flimsy layer which connects the short head of the biceps to the posterior aspect of the fibular collateral ligament.